Ondo State,
our health is our pride.
we got to say,
All and sundry, our health is our pride.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
oh no story again. All eyes have seen, all mouth can tell. Ishe takuntakun of Ondo State government in a sector.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
I'll be a program. Mother and child hospitals, Ganifa when you meet diagnostic center in Ondo. Eyeglasses distribution, festival of surgery in place. Trauma and emergency center and care are in place.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
Welcome to a new quarter on our Health Our Pride, where we discuss several health initiatives in Ondo State. My name is Adedoke Yewande.
Our health, our pride.
We begin this quarter with the latest stride of government in the sector, which is the launch of ORIREWA and the ultramodern cold chain store at Okeda. I am sure you're wondering what ORIREWA is. Just sit back and relax as we bring the details to you in a jiffy.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
Nigeria today is still faced with the challenge of accounting for a high percentage in the global burden of infant mortality, as it is on record that 191 children currently die in every 1,000 births, one of the worst child survival rates in the world. This perhaps explains why Nigeria is also ranked 19th from the rear among 145 countries with highest infant mortality rates in the world. Greatly responsible for these include polio and other childhood killer diseases that have been a thorn in the flesh of successive administrations in the country, prompting them to intensify campaigns at all levels against this global challenge. This led to the conceptualization of several child survival strategies like routine immunization and polio plus days and maternal, newborn and child health week, which was specifically adopted at the 53rd National Council of Health meeting in March 2010. This strategy was to provide low-cost but high-impact and quick-win intervention for nursing mothers and children. In Ondo State, the immunization schedules facilitated free vaccination against tuberculosis, whooping cough, poliomyelitis, measles, yellow fever, hepatitis for children under 5 and neonatal tetanus for nursing mothers and vitamin A to boost immunity. All these were done with distribution of free drugs, long-lasting insecticide-treated nets, as well as lectures on household lifestyle tips and personal and environmental hygiene like hand washing. There has also been a definite collaboration with the Maternal Pulse Foundation, an initiative of the wife of the governor, Mrs. Uluke Mimiko, which has equally been at the forefront of child survival campaign through our programs like the monthly baby meetings. Today, Ondo State has topped the chart on immunization in the last 3 quarters according to statistics from the Nigeria Governors Forum. And beyond all this, The present administration in Ondo State, in its novel approach to governance, believes immunization must be done effortlessly by the parents and community-driven to ensure a profound campaign in this direction. This was why it initiated the homegrown idea christened ORIREWA. ORIREWA is Ondo Routine Immunization, reaching every ward always. The launch of this initiative also coincided with the commissioning of the ultramodern cold chain store at Okeda in Akure, the state capital. The cold chain store is equipped with sophisticated solar freezer, cold chain store, a store for dry immunization materials, offices for data management, training, and e-logs, pick-up van, as well as tricycle ambulance emergency services. The state governor, Dr. Olusegun presided over the ceremony, which equally had in attendance his wife Olukemi, top government functionaries in the state, representatives of the Nigeria Governors Forum, as well as developmental partners like the World Health Organization, United Nations International Children Education Fund, UNICEF, the National Primary Healthcare Development Agency, who have all been at the forefront of child survival campaigns. The State Commissioner for Health, Dr. Dayo Adeyinju, explained that ORIREWA has been designed to protect all children in Ondo State from vaccine-preventable diseases, to ensure community participation in the immunization campaign, and make parents effortlessly take their children for immunization.
Beyond delivery, we want to ensure that all these children can live beyond the age of 5 without any physical challenge and be able to benefit immensely from the two numerous good things that were brought to Ondo State since inception of this administration. So today, we are going to witness another giant stride and landmark achievement in the area of health sector by commissioning this cold chain and then launching the ORIREWA program, which is Ondo State routine immunization that is reaching every ward always. And we know that this is very critical. Thank you, Mr. Governor, I salute you as I welcome you to this occasion. And I would again like to thank the wife of the governor, who is the founder and initiator of the maternal pulse, that feels the pulse of all of these women. Because beyond delivery, again, another thing that takes them away is poverty. And she has been very helpful. We have too numerous to count triplets that are under Maternal Pulse Foundation. We appreciate you, Your Excellency. Thank you so much.
He added that the ultra-modern coaching store will promote effective distribution channel that will ensure a regular servicing of outreach posts in the community, provide training, sensitization, supply chain equipment, regular and quality data management. Dr. Adeyinju says government has well designed the program in a way that it will be integrated into the existing ABA Safe Model program to ensure its sustainability.
We want to ensure through this program that there is seamless supply of vaccine. We don't run out of stock of vaccine. We want to promote community ownership of immunization such that we don't have to compel them to take their children for immunization. We are strengthening our health system and we are leveraging on the ABA Safe Motherhood program, which has as integral part immunization. So we're using the template of having the tricycle ambulances, having health rangers, and then the mobile phone as tools that will ensure that all children born under the ABA program in Ondo State are duly immunized. So we can reduce drastically to the barest minimum on immunized children in Ondo State and again sustain the polio-free state that we have been able to have since the inception of this administration.
The State Governor, Dr. Mimiku, noted that this administration remains committed to providing qualitative and exceptional healthcare services for everybody in the state, irrespective of their location.
These two events are aimed at ensuring the good health of our children and women of childbearing age. I want to again remind you all of our commitment to the survival, protection, and development of our children in our sunshine state of Ondo State, which has brought about the establishment of mother and child hospitals, mega primary schools, and adequate support for the expanded program on immunization, as well as the polio eradication initiative.
Dr. Mimiku informed that government has instituted a 7.2 million naira running grant to the primary healthcare departments of the 18 local government areas for routine immunization activities.
The project was embarked upon to raise the vaccine storage capacity of the state to the World Health Organization recommended standard, and also to ensure adequate vaccine cold chain management system. This is in fulfillment of our promise to the people of Ondo State and the country and international agencies. ORIREWA, a project being launched today, is designed to ensure the realization of the expanded program of immunization's vision of making routine immunization community-owned, community-driven, and community-operated. And let me just say, at least 7 facilities in each local government. That will include the general hospital, the 2 comprehensive health facilities, and 4 IBA facilities in each of those local governments. So we are talking of 7 times 18 facilities where we now have routine immunization.
This, he noted, is apart from the regular support for supplemental immunization activities such as immunization plus days in maternal, newborn, and child health week by each local government areas. The governor expressed optimism that the initiative will in no small way further reduce infant and maternal mortality in the state.
This project is an adopted model and strategy for ensuring the protection of all eligible children in Ondo State from vaccine-preventable diseases, thereby reducing the infant and maternal morbidity and mortality rates in line with the Development Goals 4 and 5.
The developmental partners, one after the other, means no words in saluting the proactiveness of the Ondo State government at conceptualizing ORIREWA, in a verse that it was one idea that would not only bring remarkable results for the government, but also set a veritable template with which other states must emulate to aggressively help Nigeria wage a successful war against childhood killer diseases.
The routine immunization is a very critical milestone if ever we were to achieve the MDG goals. The Governor's Forum Secretariat has been tracking the performance of states, all 36 states, particularly around immunization. And I think it's quite commendable to see the kind of commitment that's been demonstrated by His Excellency. Your Excellency, sir, I want to tell you that your commitment is exemplary. I wish I could take some of it and spread it out. Really, I think it's quite commendable. And I want to assure the mothers that the ultra-modern cold room will not only ensure the availability of safe and potent vaccines. In addition, it will also ensure that vaccines are readily available at all times.
This is what our governor is ensuring in our state, quality babies. Now, after the delivery of these quality babies, how do we ensure that they live many more years on earth and they are able to also be governors, the governor's wives, and things like that. It is the launching of this ORIREWA program and the commissioning of the cold chain. With the commissioning of this ultramodern cold chain, the state now has adequate room to store more vaccine. In fact, in preparation for the new vaccine that Ondo State will be part of in 2013, that is the pentavalent. Instead of having one come this for 1, 2, 3, we have vaccines combined together, and our mothers will have access to this.
We have watched with keen interest your activities, starting with the BA project, which ensure that our mothers have safe deliveries and we have safe babies are delivered safely, so we ensure that they survive. In addition to that, you have gone on with the ORIREWA project, which would ensure that they are fully immunized. And this is in your aim to meet the MDG 4 and 5. We congratulate you on this effort. We would like to say here that this is one of the states that has built this ultra-modern facility solely without support from the donors. And we say well done, Mr. Governor. We look forward to seeing more of this and more governors taking up this challenge. We also listened to your speech when you represented the governors and your commitment to kicking polio out. And we know that this is all in an effort to ensure that Ondo State remains polio-free and that you sustain and maintain routine immunization, because it does not only stop with polio, we have to maintain the routine if we want our children to be fully immunized and to reach their full potential. We would like to suggest to you, and we are willing as UNICEF to partner with you even in their BA program to ensure that even as our children survive, they thrive. And therefore would offer ourselves to work with you to ensure that all of their BA centers are also baby-friendly in terms of exclusive breastfeeding.
I even listened to people from Ondo State, they came to me, people from Ondo State, they said they want this BA program. So I told them they will pay consultancy fees for us because we are the initiator. So I want us to really thank Mr. Governor and Mama BA and the local DOJ and all the executive members of the state. Our cabinet, without their support, we cannot go on because they own the community. Also, all the people, the executive members, and all other protocols of that. We really thank you, people of Ondo State. This is, I cannot express it because it's too much. It's not support of WHO. I also want to talk about the RI funds released to us. I think there's no other state releasing that money in Nigeria. So I want us to clap for them. This is good for our state. We just say the only state releasing that fund is the FDA for routine immunization. And it has really helped us because we won the last prize. And I know by the grace of God, we are winning the next prize in Jesus' name. I want you to continue to, we want to continue to pray for you because the work you have started will continue in Jesus' name.
The governor thereafter commissioned the cold chain store.
In the name of the Father, in the name of the Son, in the name of the Holy Spirit.
People in this chain, they take the vaccines from here to the local government headquarters. Then the tricycle ambulances will take the vaccines and deposit them at the facilities at community level. In the name of the Father, in the name of the Son, in the name of the Holy Spirit. We commission this whole room to the glory of God Almighty and for the survival of our children in Ondo State.
After which, the Commissioner for Health conducted the dignitaries around the facilities.
Now we've got the evidence to show all African nations vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
Welcome back. I believe you will agree with me that ORIREWA is indeed a right step in the right direction towards tackling all childhood killer diseases in Ondo State.
Our health, our pride.
Away from immunization issues, the euphoria over the re-election of Governor Olusegun is not yet over, as the Ministry of Health also rolled out the drums to celebrate this landmark victory.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
The prayer session was to appreciate God for the success of Dr. Olusegun Mimiko in the October 20 governorship election, and interestingly, it coincided with the first day of the month prayers. The meeting was a very auspicious one for the health family and had in attendance workers from the Ministry of Health, Hospitals Management Board, as well as all health tertiary institutions in the state. The Commissioner for Health, Dr. Dayo Adeyanju, thanked the workers for standing by Governor Mimiko during the election and assured that their confidence in him will be justified. This, he noted, will be evident in more robust health policies, programs for the people of the state, and charged the workers to continually work to help government record more successes in the sector.
For the victory of the last election, it is a victory for not only for Dr. Olusegun Mimiko, but for all of us, because we stood by good governance, we stood by democracy. So I congratulate us. And again, if not for all of us that were sitting down here, number one, for doing what we ought to do at the right time. So that was what formed part of what was used to campaign election. All of us in Ministry of Health, Hospital Management Board, we did what we were supposed to do for the governor to effectively stand and campaign. Even when they said there was diarrhea, people came out and said there was no diarrhea, no cholera. So when you do what is right, you will have confidence, and it is not because of commitment of all of us that were sitting down here. So again, we appreciate you for that.
He advised them to step up their efforts at helping government provide continually exceptional and qualitative healthcare services for the teeming people in the state.
One thing for your governor to be committed is another thing for your worker to share in that vision. And which is the disconnect that they had. But when you look at Southwest, Lagos State scored 4. Why we scored 11? All those, what's the name of the Ekiti? It's only Ekiti that scored 6. Then, what's the name of this other people? Osun 2 and all of 3 and all of those things. So when we talk about even progressive at the level of healthcare, they are not even progressive. So they now want to come and capture.
The commissioner and his team then headed for the State School of Nursing, where he also shared the joy of the moment with the students. Dr. Adeyanju assured them that Governor Mimiko is always committed to giving only the best to the students.
We already have in stock hostel that will be so befitting, where you don't have to go outside to say you want to pick up some few things in terms of mini corner shop, internet services, library.
Next was the State School of Health Technology, where the students in their large numbers gave the commissioner and his team a rousing welcome. The students sang to God in appreciation of Governor Mimiko's victory at the October 20 governorship election. On his part, the commissioner thanked them for their continued support for the present administration, particularly for not allowing money-bag politicians to buy them over during the election. He affirmed the government's readiness to make this school one of the best in the country.
We shall continue to do more and more. An environment that will be conducive for learning. Foreign things are coming. There are too many, too numerous to count. And I have no doubt in my mind, we'll continue to be passionate and caring like we are doing.
The leadership of the two institutions on their part pledged to help government drive its vision for the schools.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All is hungry, our health is our pride.
As you can see from the report, this means that people always rejoice when the righteous rules. This is all we have for you today. Keep being fit, stay healthy, and remember, our health remains our pride in Ondo State.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All is hungry, our health is our pride.